This is a presentation for oral health care in nursing homes by Kylie, Riley, Justine, Nayeli, and Carly. In this video, we will be discussing home care, what to look for in elderly patients' oral cavity, common oral lesions, and how to help a patient that is in pain.
Toothbrushing. It is important to ensure that the patient is brushing 2 times a day and flossing. If dexterity is an issue, an electric toothbrush may benefit the patient along with the use of a water flosser. If the patient is unable to brush and floss their teeth, they may need to have a nurse or an aide do it for them to ensure they're removing food debris and plaque from their teeth.
Well, for elderly patients and those who are in nursing homes, it can really pose a challenge to brush your teeth on a daily basis. What I tell my elderly patients who do have difficulty is to try using an electric toothbrush. These toothbrushes will certainly do the job for you while you just have to hold them in place. And quite often these brushes have timers on them so that you know that you're brushing for the proper amount of time.
Flossing. Because flossing may be difficult for an elderly patient due to mobility limitations, there are some aids to help. These aids include floss holders. These floss holders can be pre-strung with floss, like a floss pick or a long-handled floss pick, or they can come with no floss so that the patient can use whatever floss that they like. There is also another aid called a water pick. Water picks can help flush out any deeper pocket that may have developed over their lifetime. One quick tip with a water pick is to add mouthwash so it can clean and kill bacteria at the same time. Lastly, it is important for them to clean in between their teeth at least daily, and they may require some assistance.
For your denture, you must remove your denture every night and leave it in water. Before you use your denture, please make sure that it's well cleaned. You must make sure that you clean the outside surface, the pink surface, all of the bite and the lip surfaces as well as actually clean in all the nooks and crannies of the actual denture. Please don't forget the actual fit surface. This is really important as this is the surface that will actually contact your gums. Make sure that you remove any fixodent or fixative material, and you actually remove any food particles in this area as well. When you finish cleaning your denture, you must make sure and just recheck, make sure that all of the teeth are free from any food particles and any stains, and also all the bite surfaces of the teeth as well. So in my hand here, I have a specialist denture brush. It's quite soft bristles, and you don't use it with toothpaste because toothpaste contains fluoride and it can be quite abrasive and actually damage your denture. So you can just use this with normal soap or sort of a fairy liquid, or even a specialized denture cleaner. You can use it to clean the surfaces of the denture and the smaller area to clean the nooks and crannies of the actual crevices of the teeth. You can place your denture in a specialized denture pot, such as so, overnight in a denture solution or just in water. You can even just use a Tupperware box as well, which is equally as good. There are special denture solutions that you can use to clean your denture with and soak your denture in overnight. So it's important to clean your denture teeth, but it's equally as important to make sure you maintain the oral health of your own teeth. Make sure that you brush and floss your own teeth with a good fluoride toothpaste to make sure you retain your own teeth as well.
One of the things to look for when providing oral care to your residents is tooth decay. Tooth decay may be identified by noticing a dark spot or possibly even a bad odor that you might notice in your resident's mouth. You may even notice a change in eating habits, or possibly they're having difficulty when they're eating. Anything that you might recognize that is out of the ordinary. The older population is at risk for tooth decay because of their gingival recession, which is when the gums recede and it kind of exposes the root surfaces, and they're more susceptible to getting cavities. Also, certain medications that they take, that can lead to causing dry mouth, xerostomia, and that also leads to cavities. So the older population does have a lot of untreated decay, and it's kind of our responsibility to contact a dentist if we notice any of these signs or symptoms that our patients are having.
If there is noticeable movement in the patient's mouth, this is a sign of mobility. Tooth mobility ranges in severity from little movement to moving up to 3 millimeters in any direction. Periodontal disease is the biggest factor in tooth mobility. If you notice that any of your patient's teeth are mobile, it is important to contact their dental professional and have them be seen.
Pain. If the patient is experiencing pain in their mouth, they need to have the pain assessed by a dental professional to see what is causing the pain. Pain in the mouth can be caused by numerous things, such as a tooth sensitivity, an abscess, cavities, a cracked tooth, along with many others. Having the pain assessed and treated is very important to help prevent any further development of pain in the mouth.
Epilepsy fissuratum. Epilepsy fissuratum is a hyperplasia that develops on oral mucosa from a poorly fitting denture. It may appear as a tumor-like lesion and redness around where the denture rests. As you can see in the photo we got from Medscape, it is very painful and uncomfortable for the patient. Since epilepsy fissuratum is a pseudotumor, it does need to be surgically removed. The patient will need to get a new denture or go to the dentist and get the fit of the existing denture altered. The best way to prevent this from happening would be to check the resident's mouth on occasion for red marks left by the denture, and by checking for red marks anytime they mention pain in their mouths under the denture.
Oral candidiasis is an infection of the oral cavity by Candida albicans, appears as white plaque that can be brushed off and is typically red underneath.
If one of your residents is in pain, you can help them by contacting their dentist. Sometimes they will be unable to communicate the pain that they are feeling in terms or words that we might know, such as sharp, throbbing, or ache. So we just want to make sure that we are watching for any changes in their behaviors or anything different in their habits, and to recognize the signs of decay. But if you suspect or think that they have any mouth pain or they're describing any mouth pain, always make sure that you contact the patient's dentist. Some dentists will even make the trip to the nursing home and make visits and come to see the resident at their home instead of having to transport them into the dental office. Some nursing homes even provide transportation if you do need to have the patient go to the dental clinic. So just make sure if you notice any kinds of pain, to make sure you contact the dental office and make arrangements to get your resident there.